In today's video, I want to share with you the simple $6 hack that's been helping my patients get fast and easy sciatica relief. Now here's why this is so important. I see too many of my patients reaching for pain medication at the first sign of sciatica. Now while pain relief is sometimes necessary, it's always better to get to the root cause of the problem. In today's video, I'm going to show you exactly how to do that. Now, sciatica can have many causes, from arthritis to a disc bulge to stuck and stiff joints. But regardless of the cause of your sciatica, spinal experts like spinal surgeons and chiropractors are recommending a minimum of 12 weeks of conservative care before you even think about surgery. One of the most common causes of sciatica is stuck and stiff joints associated with tight muscles in the lower back and into the buttocks. Now, both of these respond really well to self-massage, and my favorite tool to use for that is one of these $6 massage balls. Some of my patients like to use tennis balls or spiky balls. As long as it's not too hard, a ball about this size can be fantastic to use for self-massage. Now, just a heads up before we get started with self-massage, it's okay and it's probably likely that this might cause some discomfort. Many of my patients often refer to it as that good sort of pain. Now, while some discomfort while doing this exercise is okay, it should never hurt so much that it takes your breath away. If you find it difficult to breathe while you're doing this, or the pain is too much to handle, then either lighten off a little bit or try working above or below that area. Now, there are 3 spots that you want to work on when you're trying to help sciatica pain. Each of these is really easy to do. I like to do them standing against the wall. Now, the first spot to work along is your lumbar spine. So this is just to the side of the actual backbones in the lower part of your back. Stand up against the wall and use your pressure to push back against the ball. Now remember, a little bit of discomfort is okay. And in fact, what you're actually doing is you're searching for those tight, tender spots. And you might even find that when you're pressing on some of these spots, that actually increases the sciatica down your leg. And that's okay. Just be gentle with it. And move up and down a little bit and search for those tight spots. Now, the second spot that you want to get into along with is the pelvic joints. Now, we call this the sacroiliac joint. This is out from the center of your pelvis, and again, pushing back flat against the wall, up and down, and a little wiggle left and right. You're going to move that ball up and down about 5 to 10 centimeters. And again, if you find those tender spots, stop on them, increase the pressure. Now, the third spot you're going to get into is deep in the buttocks. And this one, rather than pressing flat against the wall, you want to press against the wall on a little bit of an angle. In fact, we're looking and working on the muscle deep inside your buttocks called the piriformis. And this is often one of the big players when it comes to sciatica. So again, here we're going to work around that area, deep in the middle of your butt, down and around in some circles, pressing that ball in. Now, many of my patients will start to see relief within 24 hours of starting these exercises, but it can take 2 or 3 days. Now, you can do these exercises every hour or as needed. Just start really gentle and build up. Now, if you're not seeing results within 2 or 3 days, then an examination from somebody like a chiropractor might be a great idea. Now, you don't have to put up with sciatica. It responds really well to chiropractic care. And if you'd like some help with your sciatica, then give the office a call on 9877-7732. I'm Dr. D, and remember, transform your posture, transform your life.